We're talking about communicable diseases, especially colds, flu, and cough. Since our children are in a confined space, if a child sneezes in the air without using a handkerchief or coughs without closing their mouth, that can lead to spread of the colds and the flu and the cough. You find that most of our children are suffering from this because of that. Then we also have fungal infections, especially for our children in boarding schools, especially ringworms. Most children suffer from ringworms because they're sharing clothes, towels, combs at school, swimming pools. So they end up struggling with fungal infections, especially the ringworm, the Tinea corporis, which we may call luomo in Luganda. Then we also have chicken pox, mumps, and measles. All these can be spread easily through children because chicken pox and mumps, the children have to be isolated. So you find before isolating the child, some of these diseases may have already spread from one child to another. Then we also have low immunity because of the diet, especially those children in boarding school. Their diet is mostly made of carbohydrates and proteins and low vitamins and minerals, which are actually necessary for improving the immunity of the child. So most of our children suffer from low immunity, and then the low immunity will lead to easy spread of these diseases that I talked about earlier. Also due to nutrient deficiency, especially for the vitamins and the minerals. Then we also have UTIs. Most of our children struggle with UTIs, especially the girl child, due to sharing of toilets and bathrooms. So if a certain level of hygiene is not kept, most of these children may end up contracting UTIs. Another health challenge would be food poisoning. I would combine the food poisoning with typhoid because they are almost spreading the same way, just that typhoid is due to taking contaminated water, unboiled water, tap water, and then the food poisoning would be cold contaminated food. Some of our children may get their lunch or their supper, they keep it and eat it later. So most of this time the food will be contaminated and cold, which may lead them to get food poisoning. The other health challenge would be constipation, especially because the diet doesn't contain enough fiber for the children at school, and also most children may not drink water as much as they would when they're at home, so they end up struggling with constipation.